Hello, this is the daily COVID update from Deccan Herald. I'm Akhil Kadidal, and in the next few minutes we will bring you updates regarding the spread of this virus from across India with a very specific focus on Bengaluru and Karnataka. At the time of this recording, we're headed towards almost 13,000 cases of novel coronavirus in the country. Close to 11,000 people are active reported carriers of the virus in India. 1,658 have recovered since they were first tested. The death toll has climbed to 434. The Indian Council of Medical Research has reported over 250,000 samples for testing so far. Over 28,000 samples were collected yesterday alone. A quick look at the numbers from India at the time of this recording. Maharashtra, Delhi, and Tamil Nadu continue to have the most cases of COVID-19. Maharashtra has over 2,500 active cases. The Brihan Mumbai Municipal Corporation has declared that Mumbai does not have incidents of community transmission so far. A 19-year-old food delivery boy has tested positive for COVID-19 in the national capital. Authorities have placed 72 houses in his delivery route under quarantine. 17 of his colleagues have been quarantined. Delhi has over 1,500 active cases. Gujarat reported a staggering 105 cases today. With this, the state has 771 active cases. Karnataka continues to be in the 12th spot, but 36 new cases have been reported from the state today. This is the highest number ever recorded in the state since the time the first case was registered a little over a month ago. With this, there are 220 active cases in Karnataka. 82 people have been discharged so far. The state has recorded one death today, taking the total to 13. A 66-year-old has succumbed to the novel coronavirus in Bengaluru. He had been on ventilator support since April 10th. Belgavi has reported 17 cases today. Of this, 8 cases had come in from Hirabagiwadi and are direct contacts of patient 224 and 225. 1 from Hukeri and 4 from Raibag have a travel history to Delhi and have tested positive on the repeat test. 4 others from Raibag are direct contacts of patient 245. Vijaypura has reported 7 cases, of which 6 are direct contacts of patient 221. The last is a 1.5-year-old baby who is a direct contact of patients 228 and 232. 5 cases are coming from Bengaluru urban, out of which 1 is a direct contact of patient 252. 1 presented with severe acute respiratory illness and contact tracing is underway for the other 3. 3 other cases have been reported from the Nanjangud cluster in Mysuru. 1 patient from Kalaburgi is a direct contact of patient 274. 1 has presented influenza-like illness, and contact tracing is on the way for the 3rd. Gadag has reported 1 case who is a direct contact of patient 166. Following the spike in cases and amid criticism that the lockdown has been a failure, the official COVID-19 spokesperson S. Suresh Kumar said that containment zones will be erected in problematic zones, within which buffer zones will also be set up. The state will seal the hotspots to prevent the spread of the virus. The buffer zones are likely to be announced tomorrow. The BBMP COVID-19 War Room has released the latest data for hotspots in Bengaluru. The hotspot designation applies to any ward which has had at least 1 COVID-19 positive case in the last 28 days. According to a report released 2 days ago, this applied to 38 wards in the city. Now, new data indicates 34 wards. 24 of these wards show 1 case each. The total tally is 51 cases within BBMP limits over the last 28 days. This includes those who have been discharged. The largest collection of cases as of April 15th is from Ward 18, Radhakrishna Temple. 5 cases have been reported from the ward over the last 28 days. 3 cases have been reported from each of the following wards: Wards 129, Wards 135, 152, and 179. 2 cases have been reported from each of the following wards: Wards 57, C. Raman Nagar, 112, Domlur, 134, Bapuji Nagar, 196, Anjanapura, and 198, Hemigurapura. Although the number of cases continue to rise sharply, the state health department's data on all patients reveal how little we know about the virus and recovery rates amongst those infected. Analysis shows that nothing seems to be relevant in predicting a patient's recovery. Not the patient's age, immunity, or even comorbidity factors can help understand how long the patient takes to recover. Among the patients admitted in Bengaluru, patient 19, a healthy 31-year-old man, made one of the slowest recoveries to date. He took 25 days. His mother, patient 22, who is 64 years old, was discharged after 21 days in isolation. The virus takes an average of 14 days to leave the system. While those in the older age groups are more susceptible to death, a 67-year-old woman and a 70-year-old man also survived the disease and were discharged within the normal 14-day period of isolation. In another instance of how unpredictable the recovery process is, patient 75, a healthy 26-year-old man, made the fastest recovery in the state so far, requiring just 9 days. According to many in the medical fraternity, the viral load or the quantity of the virus in a patient seems to be the only relevant factor in determining the patient's recovery. The assumption here is that a high viral load leads to a delayed recovery, but medical officers have pointed out that while the cause of a high viral load itself is a mystery, COVID-19 fatalities have largely occurred because it has been difficult to reduce the viral load in the patients. This results in secondary infections like severe acute respiratory infection, which eventually lead to death. Here's another aspect that has baffled the medical community in the state. A 14-day quarantine period was mandatory for those coming to India from foreign countries. This was done to curb the spread of the virus in the incubation period. However, 2 patients from Karnataka have tested positive after they completed their 14-day quarantine period. Officials say that each patient's immune system is different, and this plays an important role in the manifestation of the disease. The state government considers 14 days of quarantine followed by 14 days of home quarantine to make sure that such symptoms are addressed. So how do you treat this virus? So far, doctors have been administering paracetamol IVs to reduce the strength of the virus, which ranges up to over 102 degrees. In addition, the virus plays havoc with sugar levels, prompting many patients to be on diabetic medicine. Patients are also given 2 75 milligram doses of star flu medication, once in the morning, once in the evening. They're also administered with a general antibiotic to prevent a secondary infection such as SARI or pneumonia, which cause fatalities in COVID-19 patients. In some cases, antidepressants are also prescribed. Meanwhile, the WHO said that a vaccine for the novel coronavirus is at least a year away. India, in the meantime, will be part of a global solidarity trial for new COVID-19 medicine. 36 out of 53 COVID-19 patients recuperated when they were first treated with the experimental antiviral drug remdesivir, according to a team of researchers in the New England Journal of Medicine. The medicine was originally developed for Ebola patients by Gilead Sciences Incorporated. A bigger examination will now be carried out under the supervision of the World Health Organization before remdesivir is used by doctors to treat novel coronavirus patients. Some of the other aims of WHO Solidarity Trial are to test the efficacy of antimalarial medicine like chloroquine and hydroxychloroquine. It'll also test a cocktail of 2 HIV drugs, lopinavir and ritonavir. The anti-HIV drug was used successfully by doctors in Jaipur to treat an elderly Italian patients. However, ICMR discouraged widespread use of therapy in the absence of clinical trial data and have left it to individual doctors to decide. Moving on. India has received a total of 6.5 lakh COVID-19 testing kits from China today. The country has also procured 1 lakh RNA extraction kits from Shenzhen. A point to note, many European countries have returned faulty testing kits from China. Ever since then, the Chinese exporters of coronavirus tests have tried to obtain a registration certificate from the country's National Medical Products Administration in order to be cleared by customs in China. In news from Karnataka, with Ramzan commencing on April 24th to 25th, the Minority Welfare Waqf and Hajj Department has issued an order suspending congregational prayers at mosques. This includes Friday prayers and Taraweeh, which is performed every day during the holy month. The suspension order is until May 3rd. The order has also banned eateries near the mosques and dargahs, which are usually open during the month of Ramzan throughout the month. In Karnataka, Chief Secretary T.M. Vijay Bhaskar said that 14 essential government departments will continue work during the extended lockdown. Departments include the Health and Family Welfare Department, Medical Education, Rural Development, and Panchayat Raj. According to the circular, this notice is valid until April 19th. Those who are visually impaired or physically handicapped are exempt from work. The state government is considering a special grant to 4 road transport corporations that are struggling to pay their employees as the lockdown has stopped revenue generation. The shutting down of transportation has hit KSRTC revenue, with the corporation losing 254 crores from April 1st to the 15th. The State Education Department has launched a dedicated YouTube channel for kids called Makkalavanissk. It seeks to reach out to children easily and engage them in various activities until schools are reopened. The channels will telecast programs every morning from 10 a.m. onwards. Children can submit their videos on WhatsApp on the number displayed on the screen. They can also email the videos to the address provided in the description. To visit the Makkalavani channel, click on the link provided in the description below. Before we go, contact tracing apps are being developed every day in the time of COVID-19. One example is the central government's Arogya Setu app, which alerts people if any person in their vicinity has tested positive. But an app developed in the Indian Institute of Science campus goes one step further. Instead of identifying just primary contacts, IAAC's Go Corona Go claims to warn users of secondary and tertiary contacts as well. The risk score varies according to how close the user is to a patient. The closer you are, the higher the risk score. Other contact tracing apps, such as the central government-driven Arogya Setu, collect phone numbers, names, email IDs, smoking preferences, and mandate GPS location. With Go Corona Go, one can volunteer a phone number and GPS location, but providing such personally identified information is not mandatory. That's all we have for today. For the latest updates, log on to DeccanHerald.com. Stay safe, stay indoors, and we'll see you tomorrow.